Good morning. Myself, Dr. Avantika Sri Krishna Bamne. I am professor in the Department of Anatomy. Today, I am going to teach about the introduction to anatomy topic. Introduction to the anatomy. So now here, newly admitted MBBS, dental, physiotherapy, all students. So first lecture there will be the introduction to anatomy. So how the terminologies in the anatomy they are described, and then what the subject includes, means what the subject anatomy teaches about the structure of the human body. So that is the introduction topic. Human anatomy is the science which deals with the structure of human body. The term anatomy, yes, is derived from the Greek word anatom, which means to cut up. So the words in the anatomy, they are self-explanatory words. The anatomy can be studied again on our own body. And then what about the Greek and the Latin words? So all the terminologies in the anatomy, they are either derived from the Greek or Latin, and then how the meaning of that one should understand. So anatome is means cutting up. The another terminology is the dissection, which is Latin word and which is similar to the Greek word. So meaning wise it is similar, but anatomy is a vast subject. It is wide field of science. But here the dissection is technique, how practically on the dead bodies. Now dead body means when dead body comes to the anatomy department and embalming is done, and so now it is no more called as dead bodies, it is called as cadaver. So the dead bodies now they are called as cadaver. So on the human cadavers, how the dissection, that is the practical that is performed, and that is called as the terminology is called as dissection. It is a technique, whereas the anatomy is wide field of study. Now, which are the subdivisions of the anatomy? Yes, so such a vast subject, now it is divided into cadaveric anatomy. That means how over the means gross anatomy. A cadaveric anatomy is the gross anatomy with the naked eye examination, how the human structure that is studied on the human dead bodies, that is cadaver. So gross anatomy, now it is regional anatomy and it is studied in a, suppose means anatomy of the upper limb, anatomy of the head, neck, face region, then anatomy which includes the CNS, central nervous system, neuroanatomy that is called, then anatomy which is for the means gross anatomy studied for abdominal region, thoracic region, then lower limb, such like that. So that is the cadaveric anatomy or gross anatomy. Now what is living anatomy? So living anatomy that can be learned on our own body. Suppose so when we palpate here the radial artery, and then this radial artery, now where it is exactly present, so it can be palpated, the radial artery that can be palpated against the lower end of radius. So living anatomy that should be learned on our own body. Now what is the embryology? Developmental anatomy, it is developmental anatomy. Now in the developmental anatomy, the complete development of human embryo that can be studied in a 38 weeks period of intrauterine life, when from a day of fertilization, when two cells stage zygote, and it is how it is converted into the human adult, means how it is converted after the birth, how it is converted into the that human that newborn. So how the newborn is born. So now embryology means that is the whole complete, it is study of development of the human being, and it is completely inside the womb of the mother, it is inside the uterus of the females, and that is intrauterine life it is called as. And complete human gestation period is 38 weeks plus minus 2 weeks, and that is the normal human gestation period. And now how all the different development of general embryology, under which we study development of the face and development of pharyngeal arches, and in the systemic anatomy now how the systems they are developed, and initial period, that is the general embryology we will study, that is the embryology part. Now what is the histology? So now histology is the microscopic anatomy. Okay, so histology means histos, meaning tissue. Study of the tissue. Histos means tissue. Study of the tissue. That is the science which deals with the study with the help of, with the aid of helping with the microscope. So it is at the cellular level or at the tissue level we have to study that microscopic anatomy, histology. So it is again very interesting histology, and how the slides they are prepared, and one again it is studied under the general histology part, and again under the systemic histology. In the general histology now different means how the bones slides they can be seen, how the muscles they will look like under the microscope, structure section of muscle, ts, ls, then section of the lymphatic system, lymphatic organs. So and in the systemic histology one has to study for the histology or the microscopic anatomy related to the systems, for the respiratory system, for cardiovascular system, and so on. Now what is the surface anatomy? So the surface anatomy, again the definition wise, it is the study of deeper structures placed in the body, and that deeper structures that can be artery or vein or nerve or muscles, then which are the bony landmarks, and study of deeper parts, deeper structures of the body in relation to skin surface, and that is the surface anatomy. Now what is radiographic anatomy? Yes, so in the first year of the syllabus, radiographic anatomy is means it is radiological anatomy. So with the help of x-rays, how the x-rays they are taken, what is the view of that x-ray, particular x-ray, from where the x-rays they are coming, what are the sources of x-ray, that is x-ray tube, where the subject has to stand, what is PA view, what is anteroposterior view, what is posterior anterior, then other than that there are the different oblique views are there, and how the x-rays that can be studied in the first year MBBS class, dental class. Why? Because the normal architect means normal structure of the how the bones they can be visualized over the x-rays, how the soft parts and the organs that can be visualized under means that x-ray film is there, and how with the help of x-rays in the first year radiological anatomy, that is the radiographic anatomy is again it is subdivision of the anatomy. Now comparative anatomy, now this term has become obsolete, it is omitted from the syllabus, but comparative anatomy it deals with the study of human structure means human anatomy, and in which is compared with the anatomy related to animals. So anatomy of the animals and how the it is compared with human anatomy. So that is comparative anatomy, but now the student they don't have to study for the human anatomy, this sorry comparative anatomy, and then this comparative anatomy, and now it become obsolete. Now which is the applied anatomy? Now everything whatever the knowledge one can have from the anatomy and application of the anatomical knowledge in clinical and the surgical practice. So application of the anatomical knowledge in surgical or clinical practice, and that is called as the applied anatomy. Applied anatomy. Now genetics, again the genetics is the wide field of study where one can study about, so student has to study about the structure of genes, what are genes, then what are the chromosomes, now how the genetic material of individual that is studied, and the study of these chromosomes, karyotyping, and what are the sex chromatins, bar bodies, and then so normally how the chromosomes and all that is studied. And again, yes, now which are the different genetical disorders, so which are the different genetical disorders that is also studied in the genetics. So there are the various in 23 pairs of the genes, and out of which 22 pairs are autosomes, and how the any numerical aberration that can be studied, different diseases we know, like suppose the Down syndrome babies are there, Down syndrome, then there is Down syndrome is there, then there is Patayus syndrome is there, Edwards syndrome already. Suppose in a brief and in a very short manner, you have studied in the 12th class also what is the Down syndromes, also called as trisomy and Mongolism, and how it is the three chromosomes are there, even extra chromosome is added to the pair of chromosome number 21. So Edwards, Patayus, so these are the numerical aberrations. In the structural aberrations, now how the means how there is suppose deletion of the chromosome is there, so important part of the genes located over that particular arm of the chromosome that is deleted. So like that structural as well as so many genetical disorders, genetic counseling, prenatal advice, and that can be done by the in means how it is studied inside the subject of genetics. Now what is the history? Suppose Hippocrates in the 400 BC, it is called as the father of medicine. Herophilus, it is also called as the father of ancient anatomy. Now Claudius Galen, it is also called as the prince of physician. Vesalius, it is called as the father of modern anatomy. Henry Gray, now it is author of Gray's Anatomy. Now Henry Gray, surgeon and anatomist, he is he has written the Gray's Anatomy. Now, what is anatomical nomenclature? Vesalius, Latin word, it is Galen, Greek word. Most of the anatomical terms, therefore, are either Greek or Latin. In 1985, German Anatomical Society held a meeting and approved list of 5,000 terms known as Anatomica, Nomina Anatomica. Then it is revised by the Anatomical Society of Britain and Ireland in a meeting held at Birmingham. Revised Basal Nomina Anatomica named as revision, and independent revision was also done by the German anatomist in 1935 known as the Jena Nomina Anatomica. In 1950, it was agreed at an international congress of anatomists held at the Oxford that further attempt should be made to establish generally acceptable international nomenclature. Minor revisions and corrections were made at International Congress. An International Anatomical Nomenclature Committee were approved in the plenary session. How can gross anatomy be studied? Can be studied following either a regional or systemic approach. In the regional approach, each region of the body is studied separately and all aspects of that region are studied at the same time. In the systemic approach, system-wise study is done. For example, suppose cardiovascular system, in which the heart and the blood vessels in the body, they are studied. Now, what is the anatomical position? Now, so one is the fundamental position. One is the fundamental position, which is not important by anatomical point of view. And now this is the anatomical position. So standing, the subject or the person is standing erect, eyes is looking forward, and face looking forward, eyes is looking forward, palm looking forward, and feet close together. So this is the anatomical position, how the palms that is facing forward, and then there is the feet, they are close together, and that is the anatomical position. Now what is the supine or prone position? So now this is the supine position. Suppose the person is um, lying down on the table, his face and the eyes is looking upward, palms facing upward, feet they are close together, and then what is the prone position? So here this is the supine and the prone position. Now what is the lithotomy position? So lithotomy position during the birth of the baby, and during the parturition or during the labor, when in case of the females. So lithotomy position that is obtained during the lithotomy position is during the birth of the baby. Now which are the different planes we will study in the introduction class itself. So now anatomical planes. Now what is the median or mid sagittal plane? What is sagittal plane? Then there is the coronal plane and transverse and the horizontal and oblique. So now median plane is which plane, and mid sagittal plane is which plane? So median plane, it is passing through the axis of the body, it is passing through the midline of the body and equally dividing the human body into right and left equal halves. So right and the left equal halves. So that is the median plane. It is also called as the mid sagittal plane. It is also called as the mid-sagittal plane. Now what is the sagittal plane? So sagittal plane is the any plane which is parallel. So any plane which is parallel to the mid-sagittal plane or median plane, that is the sagittal plane. Now next slide we will study with the help of diagram. Okay, so there is the slide which is showing different planes are there. Now what is the coronal plane or what is the frontal plane? So coronal plane is how? So coronal plane where means corona means crown. So here the crown. So coronal plane is how completely means how it divides the human body into anterior and posterior parts. So coronal plane is how anterior and posterior part, that is coronal plane passing through the this midline. Now, so here this is coronal or frontal plane. Now, what is the transverse plane? Transverse plane is how median or sagittal plane are there, coronal plane is there, and plane which is right angle to the median plane or sagittal plane and coronal plane, and how dividing the body into upper and lower parts, dividing the body into upper and the lower parts. So that is the transverse plane. Now what is horizontal plane? So horizontal plane, again this is the transversely placed, dividing the body into upper and the lower parts. Oblique plane is the plane where there is no any oblique plane is how it is described. So the plane which is other than the median, sagittal, coronal and transverse, that is oblique plane. Now this is the diagram. So now this arrow, it is showing, this pink color arrow, it is showing that this is the sagittal, mid sagittal plane, which is dividing the body into right and the left halves. Now this is the coronal plane, which is dividing the body into anterior and the posterior parts, and then this is the transverse plane dividing the body into upper and the lower parts. Now again here one can understand horizontal or transverse plane dividing the passing through the umbilicus, suppose, and dividing the body into the upper and the lower parts. Now here one, this is the median, I'm sorry. So now this is the terms in relation which are the commonly used in the gross anatomy. Now, which are the terminologies used commonly in the gross anatomy? Now, this is the anterior, that means front side of the body. Anterior means that is the front side of the body. Now, posterior is the back side of the body. Now, what is superior? That is towards the head end. Superior, which is also called as the cranial, but cranial word is commonly used in case of embryology. So there is superior, then there is the inferior, then what is the medial? Okay, so inferior, it is towards the leg end. Now what is the medial, which is close to the midline, and lateral is the away from the midline. Now these are the different terminologies. So now here there is so here superior, inferior is there. This is anterior surface of the body. This is posterior surface of the body, superior and the inferior surface, and this is the median plane. This is the mid plane. Now, so here, now these are the another terminologies. Anything which is coming inside, that is the invagination. Anything which is coming outside, that is called as the evagination. And now this is the evagination, and now this is interior, it is on outside, it is exterior. Now the portion or the part which is close to the skin surface, and that is called as the superficial, and part which is deep, it is called as the deep, and deep it is also called as profunda. Now the terms of the relation commonly used in the embryology, comparative anatomy, but sometimes in the gross anatomy. So what is ventral? So ventral means the anterior aspect. Means in the gross anatomy, the ventral is meaning the anterior aspect, and means ventral means front surface of the body, which is the term commonly used to denote the anterior front surface of the embryo. So that is, suppose from the front surface, when ventral surface of the that growing fetus or growing embryo, and then there is the attachment of umbilical cord, right? So that is on the ventral surface. Now what is the dorsal? So on the posterior side or the back surface, that is the dorsal surface, or dorsal meaning, what is the dorsal meaning? Cranial again. So that is in the gross anatomy, suppose it is denoted as a superior and cranial or rostral. Then what is the caudal? Okay, cranial or rostral. What is caudal? That is towards the cranial, towards the head end, or it is also called as the rostral. And caudal, it is towards the lower end. Caudal, it is towards the foot end. Now which are the special terms for the limbs? Now what is proximal, what is distal, what is radial, what is ulnar, tibial and the fibular. So proximal, so that is anything which is close towards the axis of the body, that is proximal, distal which is away from the axis of the body. Now radial, that is means suppose this is the radial border of the forearm, radial border of the forearm. Now here is the, and this is the, on each this side this is the ulnar border of the forearm. So this is radial border of the forearm and this is ulnar border of the forearm. Ulnar border is medial and radial border is lateral. Now what is tibial and fibular again in the lower limb? Tibial border is the medial border of the leg and fibular border is the lateral border of the leg. Now special terms for the limbs, suppose whatever the surface is pre-axial border and means for the limbs post-axial border, which is flexor surface, which is extensor surface, which is palmar and which is plantar. So here the pre-axial border, so here the pre-axial border is, so during the position means during the intrauterine life, so how the human embryo, that is his spine is flexed and then his the upper extremities and lower extremities they are again flexed condition, and then the border which is close towards the axis, this is called as pre-axial border. So in case of limbs, pre-axial border, for it is the lateral border or radial border. So this pre-axial border, or it is lateral border, or it is the radial border. So radius is there, so radius is also called as the, it is pre-axial bone. But in case of lower limb, pre-axial border is tibial border or medial border of the leg. So pre-axial border is for the lower limb, it is medial border or um, where the tibia is placed. So tibia is pre-axial bone, but here radius is pre-axial bone. Radius is pre-axial and it is homologous with the tibia. Though tibia is medially placed, means it is medial bone, and radius is the lateral bone of forearm. Tibia is the medial bone of lower limb, means that leg region. Now what is the flexor surface? So in the upper extremity, anterior surface is the flexor surface, but to the opposite of that lower limb, which is the flexor surface, so posterior part or posterior aspect of the lower limb and the thigh, so that is the flexor surface. Now extensor surface in the superior extremity, in the supex, this back portion is the extensor surface, and in the lower limb the front or anterior aspect is the extensor surface. Now this is the palm of hand and this is called as the palmar surface. So everything, any muscles, nerves and the vessels, how they are studied in the palm of the hand, and then this surface is called as the dorsal surface. This is called as dorsal surface, this is called as palmar surface. Same terminology in case of the lower extremity, plantar surface, and plantar surface is the sole of the foot, and front of the foot means from the upper part when we see down, and that is the foot surface opposite to the sole, so that is called as the dorsum of the foot, that is called as dorsum of the foot. Terms used for describing movements. Terms used for describing movements. Flexion, extension, adduction and abduction, circumduction, medial rotation, lateral rotation, axial rotation, opposition. So how, which are the different movements that will take place at the joint, and so that is called as the flexion, extension, abduction and the adduction. So that's how here the introduction topic that can be studied, this topic introduction, in two separate classes for the MBBS student, and means how slowly we have to explain and the student should learn about introduction topic in the general anatomy book. There is the general anatomy books are there, and then students should learn about that. Thank you.